Well, welcome again to our last session of the plenary, and it's really going to be exciting to hear this session. I have to say, I've, over a number of recent years, worked closely with Major Dean Pallant in some areas in our zone, and it's one of my great pleasures to have met over that time Lieut-Colonel Sara Chagas, who is now the Territorial Social Women's Ministry and Social Services Secretary in the Mexico Territory. And she's given us a wonderful paper. I hope you had a chance to look at it, but it's a terrific paper. And I'm going to invite Sarah now to come and share with us how can we serve suffering humanity with few resources. Thanks, Sarah.
Well, good afternoon, everybody. Sorry that I have a bit of a sore throat, so I'll try and be as close to the mic as possible and hope that you can hear me. A deaf person was going to come this afternoon, so I hope at the back the deaf person can hear me too. Well, the question that was posed for this afternoon is excellent, and I'm so glad that it's been brought up for our reflection today. At the outset, I would like to state two things. The first is that although suffering humanity encompasses various types of people, I've chosen to address the poor inasmuch as the Salvation Army has historically had a bias for the poor. This was recently reaffirmed by General André Cox when supporting the Pope's call to eradicate famine, when he said, as Salvationists, we have been called to serve the world's poorest people, those who have nothing. And secondly, resources for the purpose of this paper will be understood as financial, because depending on how we work, other resources will be available, as I will mention below. Before we go any further, I would like us to remember that the Salvation Army started out with its main focus on the poor in the East End of London. Initially preaching the gospel to them, but further on understanding that the submerged tenth of England also needed a practical gospel to bring about effective change. Although the ambitious Darkest England scheme had that intention and offered the most diverse opportunities to the poor, it would seem that the Salvation Army in the years that followed, with few exceptions, developed its help to the poor on a very institutionalized basis. Due to various economic and social situations, it took on the role of a provider of services. Hence the slogan, and we've spoken a lot about slogans in the last few days, where there's a need, there's the Salvation Army. This institutionalized and provider way of working led to the Army having to set up structures to keep the machine going and to make things more functional. And to make things more functional, it divided its mission into field and social work at a very early stage in its history. As the Salvation Army opened fire in more and more countries around the world, and especially in poorer countries, the provider and institution stream flourished. The difficulty with this being that as the Army took on the role, it made itself responsible for finding the financial resources to keep this structure moving forward. Looking back on recent history, we will find that situations outside and inside the Army brought about changes of practice. Outside the Army, we can mention the evolution of social sciences over the last decades and their impact on the understanding of development, and also the Lausanne Conference on World Evangelization in 1974 that raised the social/evangelism discussion among evangelical Christians, brought on by Latin American theologians Samuel Escobar and René Padilla, among others. Inside the Army, discussions began to emerge regarding changes of practice, so much so that the Salvation Army held an international development conference in London in 1986 to discuss and reflect on this subject and how to move forward in what had become a changing context. However, it would seem that an important turning point for the Salvation Army was not so much the debates going on outside the Army, important as they were. Rather, the Salvation Army was facing real situations and was having to deal with much tougher questions and find immediate answers. The HIV/AIDS pandemic was sweeping through Africa. Thousands were losing their lives. Children were left orphaned. Whole families disappeared. And hospitals and clinics, including those of the Salvation Army, were not capable of dealing with such a health disaster. What were they to do with all the infected people? How to deal with all these families? How to tackle such an enormous problem if institutionalized health could not cope? How would there ever be enough financial resources for a problem of this magnitude? Answering these questions helped the Salvation Army to have to think through its modus operandi and begin to work outside the framework of its institutions. Somewhere had to be found to put up all these people. There were not enough beds in the hospital, clinic. Somebody had to look after all these sick people. The hospital, clinic didn't have the staff to do that. And somebody had to help prevent this pandemic from spreading even more. And the hospital, clinic couldn't because it was overwhelmed by looking after dying patients. How could this tremendous problem be solved? Only by involving the community. The community wanted help from the hospitals and clinics, but the hospitals and clinics needed help from the community. In other words, they needed to work together to face this enormous problem. And many of these people who were poor and were in the process of losing their lives, or were having to deal with the grief of losing loved ones, or were trying to readapt family life after so much loss, were the very ones that helped the Salvation Army to see a way forward for mission in the 21st century. The fact that the problem was so great led to the understanding that the Salvation Army's way of working in that context, institutions that helped those in need, did not function. The financial strain was obviously far too great. However, this experience has led to over 20 years of action, reflection, and reflection, not only of ourselves, but also involving ourselves with other organizations that have been grappling with the same situation. In the case of the Salvation Army, it would seem that this action-reflection process has made us think how our theology and our understanding of Christ's mission, his life and his teaching, should not only affect the way we act, but also and especially the way we work. In other words, how we see the poor and how we react to poverty and our understanding of development. So how do we face it? What is the method? What manual do we follow? Unfortunately, it's not so straightforward. There is a working model. There are basic biblical beliefs. There is a mission of taking the transforming gospel. And consequently, there's a great measure of expectation and hope. But there are no easy answers. The starting point is stepping out of our buildings and safe places and walking alongside people as Jesus did, starting where they are. We should probably start with John 1, verses 1 to 4, the incarnation. And following the Message translation, which says God has moved into the neighborhood, Leonard Sweet has boiled this text down to two words: be there. In order to be there, Jesus left his home on high and became one of us. He lived on earth, he knew poverty, he knew what it was like not to have a place to go or to rest. He met and lived amongst poor people, sick people, those who could not fend for themselves, and he called them blessed. To be there is not necessarily to provide, but it's about knowing people's concerns and their worries, their hopes for the future, and how they relate to each other. Salvation Army doctrine teaches us that God is everywhere, and his grace is already at work in the lives of people when many times they themselves do not know it. More than that, all people were created in the image of God, the implication of which are, firstly, that we are equals. We are not superior. All of us have sinned and fallen short, we are reminded in Romans 3:23. People should be respectful for who they are, and moreover, for what they can become. Secondly, we should remember that our God is essentially a relational God, and therefore his creatures are also relational. They need other people. They need to feel loved. They need to feel they belong. They need to feel that they are wanted and valued. And thirdly, God is creator, and therefore people made in his image are creative, innovative, and can come up with new ideas and alternatives. The story, initiated in the prologue, continues throughout John's Gospel, and we learn that Christ died for each one of us. And although some people may not yet have discovered this for themselves, we as Salvationists know that no one in the community is beyond the redemptive love of God. In fact, no culture or community is beyond that love. Therefore, because of Christ, transformation is at their fingertips. Putting all this into practice, and with the help of God, going through a process of action, reflection, discussion, change, action, reflection, and so on, has shown Salvationists a few things, and I just mentioned some of them. God is already at work in the communities before we arrive. His grace is already there, even though we don't expect to meet him in such dark places where the signs of sin, suffering, pain are so evident. He is working because of his grace. People have a longing for him. Secondly, we walk alongside people as equals, not as superiors. Not as superior beings, because we know Christ. We may have had more opportunities, but we're not superior. Therefore, the way forward and possible solutions for the community are worked on together. They don't drop in from outside, and everybody needs to be included in this process. As God's creation, people are essentially relational. And although perhaps they are in need of God's redemptive power to heal broken relationships, they need one another and can work together. They're good at teamwork. As God's unique creation, people are like their Creator. They have the ability to think, to have ideas, to innovate, and to bring about change for themselves and for those who are around them. The redemptive power of God to heal broken relationships can also heal and transform them, and refine the evil nature till it glows with grace again, as John Gowans wrote in his song. The community as such has many gifts that have been given to them by God, even if they do not yet recognize it. And these may be as diverse as land, social networks, animals, savings, intelligence, schools, equipment, production, things that can improve their life and that of their neighbors. These are just some aspects of the gospel message that I have picked out to reflect on. There are many more. But in having our focus on the transformation that God wants to bring about and putting this into practice by being there and walking alongside people, we can be certain that we are helping to build the kingdom of God. How all this actually works out in each community, the time schedule and the outcomes are unknown at the start, but they become clearer as the process moves along, as we preach many times without words, as we depend on the work of the Holy Spirit to touch people's hearts and mend broken relationships, as people begin to understand that they are the object of God's love and are treated with respect, and their thoughts and ideas are taken into consideration. As we do this, we also need to keep two important aspects in mind. Firstly, our role needs to be that of a facilitator, being there with people, getting people talking, connecting people with similar situations, identifying leaders in the community, and stimulating all involved to move forward, being light, being salt, and so etc., etc., while always remembering that we are also learning in the process. Secondly, it's important to be inclusive and make sure a participatory approach is possible, where everybody feels that they have been involved. What does all this have to do with serving suffering humanity with few resources? Well, people, families, and communities, suffering humanity, can come up with solutions for their situation and need to be heard and acknowledged. We do not want to bring in solutions from outside. We want to help people to be able to pinpoint available local, individual, and community assets, connecting them with one another in ways that multiply their power and effectiveness, and also engage local institutions. This does not necessarily mean that all their problems will be solved and that they will not need financial help. However, it does mean that a few things will happen. People will be involved and use their insights, creativity, and abilities to be stewards of their own communities and its concerns and establish their way forward. People will begin to understand that they deserve to be listened to by the authorities and society in general. Therefore, questioning, inquiring, and obtaining responses from governments as to why they have been treated differently, like why they have no schools in their community, why their streets are not paved, why they do not have access to electricity, etc., leads to them advocating for more attention and the fulfillment of their rights as human beings, as citizens, and especially as God's creation. Advocating for change should make governments and society more aware of people's situation, and it is expected that this will also bring about structural changes in communities and consequently financial benefits. The financial help that still may be required will have been identified by the community and therefore can be administered by them effectively. And in identifying local resources first, it is most likely that fewer resources will be necessary than if an outside-in solution had been found. Despite all that has been said about institutions and the Salvation Army as a provider, we must not be naive enough to think that these two things do not have a place and a time in the Salvation Army. They most certainly do, and we need them. However, if we are intentional about wanting to serve suffering humanity and bring about transformation both of individuals and of their communities, we need to begin to reflect on at least 2 points. One is that on a long-term basis, there are not going to be enough resources available to do the mission the way the Salvation Army has traditionally done it. And 2 is that we are aware as an institution that there are other ways of working which, even though they are far more challenging and we have less control on how things will develop, they are Bible-based and they enhance human dignity and respect for God's creation. It would seem that these 2 points pose at least 4 main questions for the Salvation Army. My list was a lot bigger, but I've brought them down to 4. So, as the Salvation Army moves more and more towards working with communities, what challenges does this bring to the training of officers and lay people and to our ongoing training programs? As the Salvation Army system measures effectiveness by statistics and financial reports, how will it measure the impact of working with communities? As the Salvation Army works more and more with communities, can it work differently with its own internal community? And what challenges does this bring to the Salvation Army as an organization? As working with communities functions on a long-term basis and is about creating relationships and trust, etc., what challenges does this bring to our appointment system? How will it relate to promoting and validating leaders that want quick results and want the job done? Tough questions require reflection and tough decisions for such tough times as these. May the Lord help us to keep our focus on his mission, which he has invited the Salvation Army to be part of. God bless you. Thank you.
Thank you very much, Colonel. That was a wonderful paper, and I'm going to now invite Captain Agnes Wally to come from the Switzerland, Austria-Hungary territory to respond. Yes, Commissioner. We'll move it on. Thank you. Done. Thanks, Al.
I have lost my voice in Orlando, but I will try. First of all, we might ask ourselves who are suffering humanity. As the Salvation Army, we always have on focus the poorest amongst the poor. It is our natural reaction to look first on those who we consider to have no resources of their own, but everybody has resources. Just think about it for a moment, please. All have resources such as intelligence, resilience, cultural background, capacity to stand, and various competencies. Everyone is rich with something, and we should observe and value what people have in their own hands, what they have in their mind, and what they have in their soul, rather than on concentrating on their lack of money. We always think the poor has nothing, and that we must devise solutions and produce financial help. We should find strategies without money. We should be more like facilitators, mentors, or coaches who bring people together and let the people be creative and bring their own solutions. Dr. Jean-Louis Lamboret has a long experience all over the world and also with the Salvation Army, especially in collaboration with Dr. Ian Campbell. In his book, Qu'est-ce qui nous rend humains? What makes us human beings? Dr. Lamboret's focus is on the strength of the person to help herself or himself to trust on her or his capacity and have dreams and vision for the future and to act with others. Who are the experts? The experts are the same people who have to face tremendous problems. Let me give you an example in Haiti after the earthquake. They are hungry. This is terrible, they say. Let's give them a ready meal prepared in America. But they don't want to eat this mixed rice. Why? Because we think on their behalf. We think in their place and don't take them into the process. Body, culture, and soul. Soup, soap, and salvation. All inclusive, please. I totally agree with Lieut-Colonel Sara Chagas when she says, God is already at work before we arrive. We work alongside people as equals, and everybody needs to be included in the process. Everybody has the ability to think, to have ideas, to innovate, and to bring about change for themselves and for those around them, and the community as such has many gifts that can improve their life and that of their neighbors. We should let go the power of money. Instead, we should dream, learn, act together, no longer having the experts on one side and on the other those who we think they don't know. We should analyze, appreciate, link, transform, transfer, stimulate, support, and do so all together. Our mission and vision has to be community-based, always including the local people in a perpetual process of engagement as we all move on together. When will we realize that we all have the resources we need to help each other? We will realize this when we change the way we look at the issue, our way to look at. Let's change our focus. Let's renounce the power of money. Let's give up the experts' clause. Let's give up our preconceived ideas, preconceived notions, and certainties. My prayer is that we will be humble enough to learn from the experiences of our neighbor. May God help us to renew our mind, heart, and soul so that we will be one message, one vision, and one mission.
Now we're going to have our final paper today, our final presentation paper, and I'm going to ask my friend Captain Diana McDonald from the Pakistan territory to come and share with us this very practical outworking of how we serve suffering humanity with few resources. Please welcome Captain. Thanks.
Well, here is an insight what's happening in Pakistan. Pakistan was established in 1947 with few resources to build on. People had to struggle with all the available possessions and potential. The country has been supported by overseas donations and aid since then. There has not been much development in comparison to the number of years it has been independent. As a nation, we are blessed with uncountable natural resources and the human potential to make use of them. But unfortunately, due to political instability, corruption, and less awareness about broad spectrum growth, many people still live with stereotype and outdated customs. The ability to grow economically has been declining as the country has become unstable and violated. Missionaries have contributed to the country with all aspects. They provided Pakistan not only with financial aid, but also their services through building schools, hospitals, rehabilitation centers, and many other social services centers. They carried out their services in the slum areas as well as the cities. Many local NGOs established in Pakistan are affiliated with overseas donors. Several training centers have been established to carry out their role effectively. Boys and girls are trained with skills like welding, auto mechanic, nursing for both male and female, and sewing. There are adult literacy centers to provide education for those with limited resources and opportunity. Many people leave their homes in rural areas, move to the cities to look for opportunity to learn, get jobs, and enjoy a higher quality standard of living. The Salvation Army response. I'll share a few of the ways we are currently using to serve humanity with limited resources. We try to help needy people through our service. I will highlight work in health, education, income generation, faith-based facilitation, women advocacy, and emergency services. Preventive family health care with focus on maternal and child health. Health is an essential asset to our life. Awareness about this concern and about the preventive measures is communicated through health programs. These are achieved through focus groups, activities focusing on reproductive health, pre- and postnatal health, drug addictions, and health of children, immunization and polio campaigns, adolescent, youth, and young parents program. Other health concerns like diarrhea, blood pressure, and dengue are emphasized too. As a result of our programs in communities we serve, so I want to clear it, this is the target areas where Salvation Army is serving. Children malnutrition has reduced by 70%, 80% of increased awareness on hygiene and basic healthcare among the women. Mother and child death rate has also gone down. 50% reduction with the waterborne diseases by spreading awareness about the preventive measures with waterborne diseases. We have developed health formation resources groups to work with awareness campaigns constantly. The community members have a better access to health centers and hospitals. Health-related issues are resolved more efficiently now due to such convenient facility. Improving our education standard. The literacy rate in Pakistan is still very low. Currently, it is 57%, but with a significant difference between men, who are 69%, and women, only 45%. The government is struggling to even provide basic primary education for free. People living in the rural areas have almost no means to fulfill this basic need to educate their children. They earn on daily wage basis and hardly cover for a day's worth of meal. Education is a challenge itself, as limited financial resources prevent so many families from sending their children to school. The daily income of a laborer in Pakistan is rupees 500, which is almost about US $5. Families with 7 or 8 children find it difficult to cope with providing education and the expenses, like uniforms, books, and stationery accompanied with the education. There are a few places where the government has provided school with reasonable tuition fees. Some people send only their boys to study and not their girls. Many girls belonging to the rural area are still facing gender discrimination. The Salvation Army in Pakistan has directed our attention towards providing reasonable means of education to both boys and girls. Literacy environment and its importance are being promoted among the communities. This has actually helped the community to alert the desire for basic and higher education among the young generation. Adult literacy enables them to budget and maintain their financial details both for their household and for small businesses. Income generation skill trainings. Poverty has been a burning issue since many decades. Many have tried to resolve it, but it still manages to continue. It may be due to the inability of resource management. In the rural villages, people still believe in the combined family system. Many families have 7 or 8 children and very few to earn living for the whole household. This sometimes leads to child labor, where parents are forced to send their children to work instead of sending them to school like they should. People, they lack the awareness of family planning and have as many as children as they can, considering them as God's blessing. The Salvation Army has compiled health projects to introduce awareness about family planning and how to live happily with few children and sensible resources allocation. Our training and vocational courses have helped both men and women to develop skills and earn more to support their families and entrepreneurial initiatives. I'll just share one story. I share a case study from a Salvation Army project in Pakistan to highlight the impact we are making by our literacy projects. Salma graduated from one of our skill class. She supported her husband with his business through financial help. They own their rickshaw and he uses it as means of income for his family. Previously, he could not provide for money to fix and repair his rickshaw, which was a crucial time for the family as they had nothing to earn from. Salma applied for some financial help from Sustainable Livelihood Development Program to help to fix their rickshaw. They made a detailed feasibility study calculating the total expense and benefits that it accompanies after it's fixed. She was excited to receive that help and they mended their rickshaw. They earned rupees 4,000 before and now they are earning rupees 6,000 to 7,000 per month from it. Now they keep up their maintenance up to date. Her husband brings home rupees 200, sometimes more than that every day. From this amount they save and meet their needs. The family is happy and grateful to the Salvation Army project team. We have given them advice on how to access to resolve loan payback for micro enterprise development and livestock acquisition. Livestock initiatives and projects. Another good example of our work is seen in some inaccessible communities outside the major cities where we have helped a number of communities to work together. The people were helped to address the well-being promotion, livelihoods, and awareness for peace in their communities. In addressing livelihood issues, we helped with skill developments for income generation and livestock programs. This was funded by the Salvation Army donors from other territories through the Community Projects Management and Support System. We call it CPMS. CPMS funding complements the work we are doing and is easily fitted in the ongoing community process. These programs, with the support of local leadership and communities, address different community projects like water, livestock, and livelihood support initiatives. Our BASIC program is moving forward. BASIC is, it stands for Building Advanced, Strong, Sustainable, Independent Communities. So our BASIC program is forwarded by having good networking activities and initiatives from communities, which shows change and development among communities. Committees were keenly involved in carrying out their activities and livestock projects in their area. Extensive work was done on capacity building of the people, both financially and socially, was carried out, which empowers them to address their issues and concern on their collectively. The Salvation Army programs team kept on ensuring the participation of communities in decision-making at community level in all livestock programs. People came up with the idea of having cows, buffaloes, and goats as livestock for milk production to earn income for their families. It has been reported by the beneficiaries and our team that these programs help people to enhance their income and support their daily needs and also nutrition for the family members. People are earning better income, sending their children to schools, having better diet, and also fulfilling their other necessary needs in a better way. It resulted in better health, and people are thinking positively to move forward for their communities' social and monetary development. A faith-based way of working. Faith-based facilitation tools have really helped us to move forward towards development programs. The project department does not only carry out its own work, but also integrates with other departments. For example, the projects department coordinates with women's ministry to compile projects for young women. Together with youth department, they are working on a rising issue of today's youth. Young people are provided with social centers to bring in their concerns and queries about those issues. The project department mutually works with the training college, conducting seminars and workshops for cadets to prepare them for the community and its upcoming challenges that they will have to face. Since 2010, the Community Development Program has been part of the training college curriculum. It has indeed facilitated the cadets with the way they believe. This significant difference in cadets has helped them to be more responsible for the holistic ministry, body, mind, and spirit of all those they interact with. Communities are addressed with Bible stories, sharing different perspectives and dimensions. Here, when I say Bible stories, this is only for the Christian communities. Many people benefit from their stories for their character building, thanksgiving towards God, and with managing their needs and wants surrounded with limited resources allocation. People are taught with a useful fact to admit that relief is temporary, but development is permanent. Women advocacy. Our Women Advocacy Project was introduced in the course of networking expansion with the communities. Several workshops were conducted in the divisions to promote the issue on a wider scale. This workshop was aimed to stimulate women's perspective about themselves and other fellow colleagues. Issues referred to successful women are still not widely unwrapped and talked about, as the culture is still surrounded with men-oriented behavior. This is more extreme when the rural area are involved, as some families avoid sending their girls to school. To change to primeval tradition of thinking to this new perspective about giving women more respect and sense of honor to their existence is still very challenging. The program has the following objectives: to help women become aware of their rights, help them to advocate for themselves with knowledge to their rights. Project approaches the community capacity, somewhat that political aspect of it. Women will find a ray of hope in the darkness of gender, as the project aims to reduce gender discrimination in the social sphere of Pakistan, help women to become aware of issues in this facet, build relationships, bridge alliances with other NGOs. These issues are discussed throughout our workshops. Attendees are given the opportunity to reflect on themselves as well as the wider population affected with this discrimination. Positive feedback is being achieved, as women were grateful to receive a safer platform for themselves. This is a great opportunity for women to express their unsaid concerns and harmless opportunity to give in their opinions too. They learn more each other's experience and have built individual groups to carry on the fellowship. Emergency services. In the course of emergency duration, the Salvation Army Emergency Services in Pakistan has always been eager to provide necessary welfare. It has been an active function at the time of desperate need during natural disaster and internal instability in the country. The aim is to meet the needs of that time and carry out need assessment for it all to be effective, considering limited resources allocation. From 2005 to 2010, Pakistan faced several natural disasters, earthquake, floods, and political instability, where people were completely shattered with no hope to survive on. Emergency services team provided that ray of hope for the affected. Those people were facilitated with immediate needs, food, utensils, bed tents, as well as sustainable development requirements like building a school. The aim, goals, and objective of the emergency department can be summarized as readiness, response, and rehabilitation. This concept has been carried forward to train officers with emergency training who then can meet the needs of people effectively, keeping in mind efficient resource management. The aim is to clarify the concept and function of this department and the capacity it carries to meet its goal in the time of extreme chaos and affliction, when only limited resources are available. The conclusion is, this paper has given brief insight to the Salvation Army's work in Pakistan. It has shown how we make a contribution towards helping people with limited resources and when faced with endless opportunity to serve.
Thank you, Captain, for that very practical articulation of the wonderful capacity you used to limited resources but wonderful outcomes. God bless you. Now I'm going to invite, please, Cindy Susateko from the USA Western Territory to come and respond on our behalf to that paper. Thanks, Cindy.
First, I want to say thank you to Captain for just inspiring us to do such transformative ministry. I couldn't even imagine that the resources are limited, because it really puts to shame what we're doing in the West in our particular division in terms of transforming communities. So I want to say thank you for providing a model and a vision that inspires us. In my role as Divisional Social Service Consultant, I see the need for resources. I see limitation, and at the same time, I see underutilization of resources. Captain McDonald presents a prime example of how the Salvation Army accomplishes a lot with what I will presume is perceived to be a little. The Salvation Army repeats this worldwide, often going far beyond what might seem possible given the people, staff and volunteers, and resources, budget and physical resources that they have. So generous and desirous of helping people are those involved in the ministries of the Salvation Army that they extend themselves, taking on multiple roles and even using personal resources in their work and ministry. I agree that it can feel like we are under-resourced, serving in old buildings with no or few paid staff, few volunteers, outdated or no technology, and leadership and staff who might not have adequate knowledge and skills to lead the ministry or work. In order to build on what we have, we first need to fully assess all of our resources/assets, especially in people and relationships. Every individual, department, association, and institution needs to be assessed and accessed so that their resources might be strategically connected to the meeting of the identified need, be it violence against women or the lack of education for girls. In order to transform what we do, we need to fully know and utilize the resources within the organization at the local, regional, territorial, national, and international level. We also need to fully use the gifts of officers, employees, volunteers, soldiers, adherents, advisory members, community friends, and FBO, NGO partners. This will require some new ways of thinking and working. I believe that we as an organization have abundant resources that often are underutilized. We have what it takes to accomplish our mission of fighting sin and poverty. The internal resources of the Army and all its friends are tremendous. We need to discover them anew and perhaps reallocate them for maximum mission impact. I would challenge us to evaluate each resource and our stewardship of it. For example, just one, our good name. We don't often think of it as a resource, but are we fully using the moral authority we are granted to trigger a conscious attack with national governments to promote justice? Dr. Bob, Doctor. Thank you.
Well, it's over to you now to share your tables, and I'm sure that those papers have raised lots of questions for you in your own context, and so I invite you to share in the tables. Can I just ask the recorders to make sure that when you put them online, you actually put your table number rather than your URL, so that makes it much easier for David Clark to collate them together. So thanks for that. Look forward to your discussions.